Hello and welcome to the Osteoarthritis Action Alliance Lunch and Learn webinar for May 17th, 2023. Thank you for joining us this month. Our presenter today is Nancy Baker. Dr. Baker is an associate professor and chair of the Department of Occupational Therapy at Tufts University. She received her Doctor of Science in Therapeutic Studies at Boston University and a Master of Public Health and Epidemiology at the University of Pittsburgh. Before obtaining her doctoral degree, she was a clinical therapist for 11 years, specializing in adult physical disabilities and industrial rehabilitation. She also trained in ergonomic assessment and intervention. She was a faculty member at the University of Pittsburgh from 2000 to 2018. Dr. Baker is an internationally recognized expert in musculoskeletal disorders, particularly those related to work and arthritis. Her current work focuses on using virtual reality for pain management. Her scholarly work includes over 50 peer-reviewed journal articles, over 200 podium and poster presentations, and 12 textbook chapters. She has expertise in experimental and epidemiological methodology and has been funded at the federal, foundation, and university levels. The title of today's presentation is Using Virtual Reality with People with Osteoarthritis. Welcome, Dr. Baker.
Thank you. It's a great pleasure to be here, and I appreciate being asked to speak on something that has become quite a passion with me, which is using virtual reality as to manage chronic pain, in this case with people with osteoarthritis. In today's talk, I'm going to go over what virtual reality therapeutics is. I'll give you a little primer on it. I'll talk a little bit about why using virtual reality for osteoarthritis pain, and I will focus in on pain because that's my area of interest, and talk a little bit about how you can translate virtual reality into feasible clinical activity for patients with osteoarthritis. So let's talk a little bit about what is virtual reality treatment. And you notice I put the little RX at the end of VR there. That's because more and more people are talking about virtual reality as a therapeutic modality, as a treatment. So the VRX indicates this idea of virtual reality as a treatment modality. Just to put us all on the same page, I want to discuss immersive virtual reality, which is the area that I work in. Immersive virtual reality is when you use a three-dimensional life-size computer-generated environment and situate your individual with pain or whatever problem into it in order to be able to manipulate and therapeutically use that environment to help treat the client with the problem. To get into this environment, the participants use a head-mounted device. And this head-mounted device has sensors which track the participants' head and often hand movements, allowing them to feel as though they are actually in the environment that you place them in. There's also the ability to use what are called hand controllers to interact in the environment so people can actually manipulate whatever is happening in that environment with their hands. So in the virtual reality environment, you feel as though you are actually in that space doing whatever the experience is. And that experience can vary, anything from a highly realistic walk in the woods to some sort of odd three-dimensional cartoony kind of universe. The sky's the limit because it really varies depending upon the imagination of the person creating the immersive virtual reality environment. Virtual reality as a treatment can be used in many ways. There is research out there that is being looked at it to use to control symptoms, to improve function, as an adjunct for education and self-management, as a highly effective way to get people to exercise, and a way to help people to participate more fully in therapy. I will be talking about virtual reality in relationship to pain, again, because that is my area. But realize that virtual reality as a treatment modality is being used by a wide variety of people for a wide variety of problems. So why would virtual reality be a useful treatment for osteoarthritis pain? Well, recently I did a scoping review on virtual reality and pain in general, not OA pain specifically, but pain. And I looked at both acute pain and chronic pain. And what I found was that when I looked at these studies, Out of 70 studies that looked at virtual reality and pain in approximately the last 10 years, about 68 out of these 70 had significant effects on pain. And of 22 studies that looked at chronic pain, around 18 of these studies had significant effects on pain in various ways. VR appears to be a very effective method to reduce pain. It seems to have a great deal of effect on pain. And in fact, some of the studies suggest that the effect on pain is a 30% reduction in pain, which is equivalent to the pain reduction that you see in morphine studies. So it can be a very highly effective way to address pain, both acute and chronic. And so the question is why? Why would being yourself in an immersive environment be so effective at addressing pain? And we're still trying to figure a lot of that out. It still isn't entirely clear. And because virtual reality is still a pretty new area, we're doing a lot of work to try and understand it. But essentially, there are four potential mechanisms that are why virtual reality might address pain. The first and the one that's been studied most often is distraction. When you put somebody into an immersive virtual reality environment, it is highly engaging and highly distracting from the pain. It uses a lot of the same channels that pain would normally travel up. And when people are in there, they can't pay attention to the pain. They instead pay attention to this engaging environment that they're in and whatever they're doing in it. They basically forget they're in pain. And I've seen this happen again and again when I put people with pain into this virtual environment. They forget they have pain. They have fun. They move. They do things, but they forget they have pain. Another area that virtual reality can work through is emotion. Again, because you're in an environment where you believe that you are in that environment, if it's a happy, pleasant, wonderful environment, you're going to feel happy and pleasant. If you're petting kittens, you're going to feel like you're happily petting kittens. If you are strolling through a beautiful woods, you're going to have that sense of awe. And since pain is closely linked to emotion, we can manipulate that emotion to help reduce the pain. And in fact, because people are having fun in virtual reality, that often has a very strong effect on pain as well. Another area that virtual reality can affect pain is by enhancing other effective treatments. So if you put somebody in virtual reality, they tend to pay attention more, they tend to do things longer. So for example, several studies have shown that people exercise harder and longer in a virtual reality exercise environment than they do in the regular exercise environment. So if exercise, as we know, is an excellent treatment for pain, if we can get people to do it longer and harder and still be happy at the end, we are going to be able to enhance that basic underlying effectiveness of exercise. You can do this with things like meditation or training in mindfulness. There are all sorts of programs out right now where people are using VR to enhance existing treatments. And finally, the one that I think is kind of the most interesting is the idea of embodiment. When you are in virtual reality, you lose your own body, and instead you come to see the virtual body as being your own body. In the virtual environment, sometimes you don't even have a body. All you have is a pair of hands, as you can see in this picture here. And you can, again, manipulate that virtual body to address perceptual ideas that can reduce pain. So for instance, they are do experiments where they find that if you show somebody a red limb, they experience more pain, but if you show them a blue limb, they experience less pain. If you take a pain limb that feels like it's swollen and you shrink it, you can reduce the pain. So embodiment is a way to actually manipulate the body in the virtual environment, and by that, hopefully manipulate pain. As I say, these are all ideas. These are mechanisms that people are studying to try and understand why virtual reality is potentially so effective for addressing pain. And there are a couple of studies that show that virtual reality specifically can affect osteoarthritis. My lab did a very small study with 19 adults. It was a pre and post design where everybody experienced one 10-minute session of VR with a meditation program. And what we found was that this meditation program had a very large immediate effect on knee pain and general pain, as you can see by the bottom blue and green lines in the graph, with an effect size of 1.06, which is very large. And interestingly, there was also a moderate decrease in pain from before the session to 24 hours after the VR session. So we saw potential carryover of that reduction in pain even 24 hours after coming out of the headset. Basically, 63% and 58% of people with 63% with overall pain and 58% with knee pain, respectively, reported at least a 30% change in their knee pain, which again is similar to what people are reporting in studies on opioids. So this was pretty effective. One session, 10 minutes in a VR meditation, we saw these really large effects in pain. This other study that I'm talking about, I literally just found yesterday, and I plugged it right into the talk. This was a study that looked at 73 adults, 35 receiving the VR meditation, VR program. They had knee OA, and they received 15 sessions of 15 minutes of VR, where the VR enhanced their movement. So it helped people to move more laterally, or to bend more, or to move in directions that the therapist wanted them to do to help strengthen and make their confidence in their knees improve. And what they found at the end of these 3-week sessions, at 3 weeks, they had a large immediate effect on knee pain and a very large long-term effect on knee pain. And by long-term, I mean a month later. So a month later, they had an even larger effect on pain for those people who were in the VR group. It also, interestingly, had a large immediate effect on disability, as measured by the WOMAC. And that effect got smaller at 7 weeks, but still was on the large side even 4 weeks later. So again, these were 15 minutes of VR along with conservative treatment. And we see these large effects that virtual reality is having on people's lives. So how can we potentially use virtual reality in the clinic? I have a lot of people say, well, yeah, it sounds great, but is this feasible? Is this something that I can actually use with my clients? And the answer is yes. I am seeing very much so that VR is quite easy to integrate into a clinical setting. You do have to have some thoughts, though, before you use it. The first is to think a little bit about the VR system that you want to use. And the good news is there are several very high quality, not too expensive virtual reality systems on the market. So while the price is not cheap, it's usually $400 or $500. It is not expensive, considering the fact that you can use one system for multiple patients, and that you can buy fairly inexpensive experiences at about anywhere from free to about $50. You have to consider how well this system will immerse people into the environment. And immersion refers to the logistics of the system, how well it produces the immersive environment, whether there's any stuttering, whether the picture is clear, and how well it engages people in a sense of presence, the idea that they feel like they are actually in that environment. And presence is really important for things like distraction, because people have to really feel engaged with the environment in order to be able to get good results. There are things like whether the system is tethered, which means it's connected to a computer, or untethered, which it means that the headset is a free-floating device. And what kind of experiences are available for that particular device that you're using. Some devices only have a few programs. Other devices have many, many programs that you can use with them. And finally, how usable that headset, and if you're using controllers, the controllers are. And again, things vary. The controllers in particular can be kind of tricky because they are designed based on some of the gaming systems, and they're not always entirely intuitive, but people can learn pretty quickly how to use a controller to interact with the system. You also need to think about the experiences that you put people in. The headset is just the method to get someone into an experience. And I basically see VR experiences being either passive or interactive. A passive VR experience is one that's basically like watching a video, but isn't 360 degrees. So it feels like you are standing in the middle of that environment. There are a lot of YouTube 360 videos out there that you can put people in that are quite engaging and have been shown to reduce pain. You can also, there is no controller in there because you're not really interacting with the environment. But there are also lots of interactive games that you can buy. And an interactive game has to be programmed. It's programmed to respond to the controller, and it can range from anything to doing meditation to playing complex role-playing games. Depends on the program, the interaction, the designer. There are a variety of things that make up a VR experience. There are, of course, barriers to using VR in the clinic. The cost can be a barrier. As I say, $400 or $500 isn't necessarily challenging. It could be if you want to send a headset home with somebody. You need to have Wi-Fi access to be able to use some of these headsets, particularly if you want to be able to monitor what the person's doing in the system. But we found a simple router attached in a clinic would up the Wi-Fi access to a point where it was no longer an issue. You have to be able to find a space large enough to use virtual reality, and a large enough space is 6 feet by 6 feet, not terribly large, but can be a problem in a small clinic. And how to logistically make sure that the headset's available, that it's clean, that people are using it appropriately, things like that. You do have to have some technological knowledge. Granted, most headsets are designed to be able to come out of the box and be put on your head and be used, and they are designed for 12-year-olds. But still, there can be some challenges with technology. Anytime you're using technology, there's always chances of things breaking down. So creating a manual of operations that explains very clearly how to use it can be very important in the clinic, as well as providing training to therapists who want to use it. There is also the question of acceptability. People question this. They say, well, why would I want to use this? Isn't this going to be hard? And I recently had a student go out into a clinic and spend time there. And she found it became much more acceptable when the therapist saw her using the headset and saw patients using a headset and realized the power of virtual reality, as well as providing training to them on how to use it. And finally, of course, there is safety issues to consider with virtual reality. There is always the chance of infection. You are placing a headset directly on somebody's face. So you have to have good cleaning protocols and not use it with anybody who could transfer illness in specific ways. You are blind in a virtual reality system, or rather you are seeing a non-existent environment. So you have to have ways to protect people from walking into things, tripping, slipping, and falling. And there are built-in ways to do that in virtual reality. And finally, people can get motion sick in virtual reality because the eyes are seeing one thing and the ears are telling them another thing. Again, certain programs are more likely to cause motion sickness, and it is something that gamers have been working on for years. So the programs in general are good, although there are some out there that can be hard on people who tend towards this problem. So how feasible is this? Well, a colleague of mine works in a chronic pain clinic, and she and I sort of put together a little initial pilot study where we looked at 29 people in a chronic pain program doing 10 minutes of virtual reality, which was then followed by their regular therapy appointment. And we did up to 6 treatments. And she reported there was no problem getting people into the headset and getting them engaged and active. And we can see from the effects here that after the first visit, there was a very large effect of the virtual reality. We got an effect size of 1.2, which is very large in a D. And 22 out of 29 people had a reduction of pain of at least 2 points on a scale of 0 to 10. The second visit, we saw a similar effect. And the third visit, again, we kept seeing these large effects with high levels of reduction in pain. The biggest challenge, of course, we are dealing with people with chronic pain. People with chronic pain tend not to come back. Although what we're finding is the VR is engaging enough that people often come back because they like doing the VR and they want to do it. So we found that simply including people, VR as part of a program was effective and did reduce pain for these individuals. We are currently running a couple of additional studies where we are implementing virtual reality into clinical sessions where we are comparing the virtual reality to other types of treatments to see if the virtual reality is as good, if not better, than what is routinely done. And these studies are in the works. I have no data on them, but realize that we are doing some studies to better understand feasibility and dosage and trying to help understand how we can use virtual reality with our clients. So overall, what I hope you take home from this particular talk is that virtual reality can have very clinically important effects on pain, even for people with OA. We're seeing greater than 30% change in pain. We're seeing a greater than 2-point reduction on a numerical rating scale. So it can have very significant and important effects on pain. And it is possible, and this is one thing that I'm looking at, is that it may actually last outside the virtual reality session. Anecdotally, I've heard several clients tell me this. We saw this in this one study we did. The question is whether it actually will last if we start doing it on a more formal basis. Virtual reality can be used to address many goals besides pain, but pain is the one that I've looked at. And there are probably multiple mechanisms on how VR can address pain. Ideally, we're going to use multiple mechanisms anytime we work with a client. We might have them exercise and be distracted. So we're using multiple things simultaneously. And that virtual reality is feasible. It can be used in rehab so that we can do it for 10 or 15 minutes and do other treatment goals with it. It is a great modality for working in the clinic. I do think it's important to say that looking at virtual reality as a treatment for osteoarthritis is in its infancy. We still have a great deal to learn. There are a lot of people out there looking at this, and I believe it is going to be one of the major modalities in therapy over the next few years as we figure out how it's used and what it can be used for. So I'm hoping that my talk has made you a little bit excited about virtual reality and want to try and experiment with it a little bit more. There are multiple ways to use it, and I hope that you can experience it yourself and try it with some of your clients. So I want to thank some of the people who worked with me on the various programs that I've done. And these are some of the references of the studies that I've cited. And I'd like to throw the floor open for questions.
Thank you so much, Dr. Baker. That really was so interesting. And yes, I personally am excited about virtual reality as a potential treatment modality for osteoarthritis. So thank you for sharing your expertise and your research into this area. Anyone in the audience today, if you have a question for Dr. Baker, feel free to type it into the chat box. Dr. Baker, I was just going to mention there were 2 comments that came in while you were speaking that I just wanted to make sure you were aware of. One person stated that when you were talking about some of the evidence behind benefits of VR for OA, someone had seen a similar study on VR promoting movement and neck pain.
Yeah, yeah. There are lots of studies in various on various painful sites. I've seen neck pain a lot. I've seen the low back. They're using VR for complex regional pain syndrome. I mean, there are a variety of different ways that it's used for pain.
Great. And then a second comment, which I thought was a great suggestion, was from someone when you were talking about the need to clean the devices between users. Someone mentioned a clean box, which uses UV sterilization between participants, and then disposable paper masks. So
Yep. We
good
do
thoughts.
that. We also you can buy silicone masks that go over the edge of the VR where the headset touches the skin. And I usually take those off and wash them. So clients, we always replace the closest contact to the skin with these masks that are washable and reusable. But yeah, the clean box is a good way to clean the VR system, and that's the way a lot of people do it. But you can also wipe it down with cleaner. I have yet to have an infection from using virtual reality. We've been using it for a while now. Just got to be careful, just like any piece of equipment.
We have a question here, Dr. Baker. Have you looked into whether it is the interaction element that has an effect on pain? So whether comparing someone doing virtual reality on their own versus having someone help or support them, like have you seen any different effects on overall well-being in the 2 different scenarios?
I have not. I've not studied that particular thing. I believe that just getting into the system can reduce pain for many people by that distraction. What I'm finding though is if you want to use it therapeutically, you want that therapist interaction with it, because what you want to do is you want to help the client to reflect on how the virtual reality and the movements they've done in the virtual reality tie into their regular life. So what tends to happen when someone comes out of the virtual reality headset is they go, I was moving in a way that I didn't think I could move. And as a therapist, then I would help guide them in reflecting on, yes, you were. And what does that mean now when you go home? How can you implement that or use that in your everyday life outside of this virtual reality system? So again, you can use it therapeutically in a variety of different ways.
And this next question is kind of a follow-up and along similar lines. First, the person says, "Thank you for your amazing presentation and your work." The question is, how do you envision the integration of VR into clinics or the rehab space in general?
I see it, again, depends on what you're using it for. That's the first thing. You have to consider what is your goal for treatment, because obviously the goal is going to drive how you're going to use the virtual reality. But I see it as a modality. I see it as something that I can add to my therapy to make it more effective, whether it's pain reduction, whether it's using it to enhance some other useful treatment. Um, I need to consider the virtual reality in that way. And so how I use it then will depend upon, what the goal is, and whether I'm using it as an enhancement, whether I'm using it as a pain reducer, whether I'm using it as a way for people to understand how they move, things like that, will be how I might integrate it into the clinic. And I hope that answered your question, but you can always ask a follow-up if I didn't.
And pivoting a little bit, I know your expertise is in the clinical setting, but as we were talking before the presentation started, the OA Action Alliance manages a review process of arthritis-appropriate evidence-based interventions, which could be either physical activity or self-management education programs that help improve osteoarthritis outcomes. And these can either be in group settings in person, or they could even be virtual, kind of self-directed, or a hybrid mix of the two. But I just kind of thought about, as you were speaking and kind of going through this information, how and you may not have direct experience with this, but just kind of what you've seen in the literature and in your own work, what the possibility would be for maybe even having program delivery in the virtual reality space.
I see virtual reality as having two potential ways to do that. One is to develop these programs into things to help people pick up the concepts and practice the concepts. They've built essentially a virtual reality version of the mindfulness. That's one way that virtual reality could be used to deliver some of these programs. The other way is there's a lot of work being done right now on how to create social spaces where people can gather together in virtual environments and work together in these virtual environments. I know this is of great interest to the gamers. And so because it's of great interest to the gamers, there are a lot of people working on it. And I could see eventually these programs being delivered in that virtual environment via avatars, where people feel like they are actually there in the group when they do it in their own home. And there may actually be programs out there that are doing that. I'm just not familiar with them at this point.
That's really interesting. I mean, we know how important social support is for, especially in the context of physical activity, engaging in physical activity and maintaining it over the long term. And then with some of the other, chronic disease management programs, just the coping skills and things like that can be reinforced with that social engagement and social support. So that's really interesting. I hadn't thought of that opportunity.
Yep. Yeah, it's an area of great interest to many people at this point, and not just for delivering therapy, but just for interacting within the community. and finding ways to bring communities together in the virtual world. They're really trying hard to figure out how to do it in such a way that you actually can read emotion, read body language. The centers are getting very, very specific. It's fascinating stuff.
So I'm going to take this one last question that just came in the chat, and it's kind of along those lines. First of all, thank you for the presentation. A couple of questions here. What is the content of the VR that you are testing? Are you using exergaming for the movement or instructional content like CBT meditation? Is this your content that you created, or are these other program developers that you're using?
It's a great question. Because I am relatively new in the VR space and I don't have someone who can program things for me, I use commercially available virtual reality programs, the ones you buy off the net when you buy a headset. What I do is sometimes I can buy direct like ones. For instance, there's a very good meditation program, and that's the meditation program I used in the one study I mentioned on knee OA. That is a commercially available meditation program. It's quite nice. Or I take programs and I analyze them and I identify what kind of goals they can address, and then I use them with my clients. So for instance, if I'm interested in having somebody do particular types of arm movements, there are programs out there that really can focus on specific arm movements, and I would bring the person in and use those particular programs with them. But there are rehab programs out there. There are companies that are building programs that are more specifically designed for rehab that will get at very specific movements and allow you to document what people are doing and measure them, and you have a little bit more control than you have over the commercial program. So again, it's kind of what you can afford, what you're interested in, what you feel comfortable doing in terms of identifying programs that will address goals and things like that. I personally am working with some of my students to develop a catalog that describes some of the commercially available programs and what they're capable of doing is for goal setting.
That's wonderful. Well, this is all very exciting, and we can't wait to, I feel like you've given us a little bit of a sneak peek into what is to come. And so it will be exciting to see where this goes. And hopefully one day we'll see it a little bit more mainstream and maybe even in some of the recommendations and guidelines. Thank you, Dr. Baker, for sharing your expertise with us today. And thank you to everyone who attended today's presentation. I'm going to go ahead and pop a poll up onto your screen. If you have a chance to take it before you leave, we would appreciate it. And finally, I'll just mention that next month, our presentation will be on June 21st, and will feature Dwight Burney representing The Movement is Life. And the title is The Movement is Life Value Project. So hopefully you all can join us for that. And thank you again for coming today. And that concludes our presentation.